Hi, this is Jackie with VSG and PSA, and this is my 2-week post-op update. I had a vertical sleeve gastrectomy on April 27th, 2018 at Rex Hospital in Raleigh, North Carolina. Dustin Bermudez was my surgeon, and he's with Rex Bariatrics, or UNC Surgery, in Raleigh, North Carolina. And I'm 51 years old. I'm 5'2". My starting weight when I began this whole journey back in December 2017 was 228. My weight day of surgery was 208. So I lost 20 pounds during that 4-month or so pre-op diet. But honestly, I really didn't start the diet until February. So honestly, I lost that 20 pounds in about 2 months. I was really focused during those 2 months. So the day I had surgery, it was 208. Let's see, and then at my 2-week post-op check-in, I was 198.6. So that is a loss of 11 pounds since surgery, which is pretty good in 2 weeks. And my BMI is now 36. So I started out at 40 and now it's down to 36, which is great. And that's really what I'm focusing on when I talk about my weight loss. The scale numbers, yes, are important, and I'm watching them obviously, but I'm focused on BMI. And if anybody were to ask me what my end goal is, it would probably be to, I will feel very successful if I reach a BMI, which for my height is, I think, 27. That says that I'm normal, which I hate the word normal. Normal's a drier setting, but healthy, I guess, is the word I'm looking for. So not obese, not morbidly obese or severely obese or whatever the other titles are as you go up the chain in the BMI scale. I just want to be at normal/healthy. So that's my goal. So what's happening in the past week since I did my 1-week update? I really had no additional pain. During that first week post-op, I did have a lot of stomach spasms or stomach cramps that started about day 4 or 5, and I think that was just my body kind of readjusting itself, and my stomach and everything else just kind of settling into its new normal. And they didn't last very long, thank goodness. I've heard other people say it lasted several weeks for them. For me, it was really mild. And I also have been on a liquid diet, a full liquid diet this whole time. So my group requires, or I get not requires, but their suggestion is that you do 14 days post-op as a full liquid diet. However, I had my, finally my first post-op appointment with my doctor at about day 13 post-op. And he said, "You're doing so great." He actually said I'm doing a little bit above average for what they typically see a patient as far as, you know, my pain, the way my scars look, everything that I was telling him about being able to do my water and my protein, everything. He said, "Hey, you're good to go to move into the mushy or pureed phase," which I was very happy about, because as soon as I got home from that appointment, I ripped open a 2.5-ounce packet of tuna fish, and it was really good. I'll put a picture in here. It was really good. And I added that to, actually it was a 3-ounce package of tuna fish that was kind of pre-made. It was just something I happened to have in the pantry. So it already had some like ingredients in it, like mayo and stuff, but it was still super light, super lean. And I opened it up, and 2 ounces of it, I made a tuna roll-up with lettuce for my son, which is one of the snacks he likes after school. And then I ate the rest, but I couldn't eat it all. So I had a good couple of bites, and I chewed it, even though it was already pureed, and you know how tuna fish is, you know, in a package like that. It was already very tiny and pureed for the most part, but I chewed it up really well, and I ate it very slowly. And then that evening, I made myself a scrambled egg, because I love eggs. I think eggs are like nature's perfect food, and I have really perfected the way I like to cook them. So, and I like scrambled eggs. I don't like the yolk running. Blah. So I made scrambled eggs with some low-fat, tiny sprinkle of low-fat shredded cheese on top of it, and I was able to eat, out of that 1 egg, I was able to eat half of it. So of course I continued to supplement with protein shakes, protein powder and stuff like that, to make sure that I was getting my protein in for the day. So so that was good. As far as I went back to work after at 7 days post-op, not quite 7, 8, 9 to 10 days post-op, because I had surgery on a Friday. So I took that week off, and then I went back that Monday. And really, as far as energy, haven't had a problem. You know, I'm taking my vitamin, my multivitamin twice a day. I'm doing my calcium 3 times a day. Prior to surgery and prior to this whole process, I was already taking things like vitamin D. I was taking B12 for energy because I don't drink caffeine or anything like that. And you know, as you get older and obviously being overweight, I was feeling kind of sluggish. And so I did some research, and lots of people had recommended that I start taking B12. So I do that, and I do one that just dissolves in your mouth. So I didn't have to swallow any pills, even though the B12 pills are tiny. And I also was taking some things for my psoriatic arthritis and psoriasis that's supposed to help. I take turmeric. It's a capsule pill of the spice turmeric. And what else did I take? Oh, krill oil, which is another capsule. Now, I have not started back with the turmeric. I have not started back with the krill oil. I have started back with the vitamin D because when my blood work showed that my vitamin D levels were a little bit low. Although on that week I had off of work, I spent a lot of time sitting outside. It finally warmed up here. It was nice and sunny, and so I tried to soak up my vitamin D that way. But I've started back with the vitamin D pills, and I think probably a month post-op, maybe I'll get back into taking the turmeric and the krill oil for my psoriasis and psoriatic arthritis. Speaking of those two autoimmune diseases, you know, my channel is named for both VSG and PSA and PSA stands for psoriatic arthritis, because I really want to be able to look at this journey through that lens as well. I was diagnosed with psoriasis when I was 10. It mostly was in places that people couldn't see. So it was on my scalp, my torso, and then in college, and I blame a lot of this on my eating habits and other habits that people tend to pick up in college. For me, it was having the occasional adult beverage. My psoriasis got a lot worse, and so I started having, you know, the outward signs, the patches on my skin, on my legs and arms and other places. But I've never let it slow me down. I've never let it stop me from doing anything. I've tried probably just about every treatment you could possibly think of. So if you're going to recommend some to me, I guess go ahead, you can put it in the comments if something worked well for you. But I literally have tried everything from the diet books that say, which I lost a lot of weight on, but they didn't do anything for my psoriasis, where it was I was wheat-free, dairy-free, meat-free, sugar-free, everything free. It was like I was eating air for like an entire year, and did not touch my psoriasis. I have done everything from the very intensive methotrexate drugs, which are very bad for you, which is basically a liver cancer kind of drug, to all the biologicals. I've done every type of tar cream you can imagine. I've done every type of, voodoo magic cream. I have done every type of cream that you can buy in the drugstore, over the counter, prescription, you name it, I've done it. I mean, I've had this disease for 40 years. And so right now, the most effective things for me have been the biologicals, and I've done several of them over the past 20 years. I'm on one now that's working very, very well for me. Unfortunately, my insurance plan just decided to not cover any of them. So I'm having to get creative with those because they're not cheap. But over the past probably 4 to 5 years, I've actually developed the psoriatic arthritis side of psoriasis. So for those of you who aren't in the know, psoriasis can manifest itself outwardly through the skin and the plaques and the visible stuff, or you could just have psoriatic arthritis and not have the outward plaques. A lot of times, though, people, if they start with one, they eventually develop the other. And so there's been research on psoriasis literally since the time of the Egyptians. That's how long it's been around. And, they're getting better and better with science and being able to really target the genes and the other things that really cause this disease. But like many autoimmune diseases, you can throw out lots of them out there, all the different, psoriasis, arthritis, or at least the rheumatoid arthritis, the JRA, the lupus, all those kind of autoimmune diseases, Crohn's. They're really tricky diseases because you just never know what's going to trigger them, what's going to help them, and you can be on something that works great for you for 5 years and then suddenly one day it doesn't. So anyway, it's a tough disease, and the reason I give all this background, and sorry for those of you who are just here for VSG stuff, but the reason I give that is because anytime that you have psoriasis and you have an injury to your skin, psoriasis tends to go and attack that area and inflame around that area, because that's what psoriasis is. It's really the overgrowth of cells, and it's your immune system thinks that you've been harmed in a way that needs to have extra production to heal these places, but really what it does is it causes additional damage because your body is confused. And that is a very layman, non-medical explanation. So forgive me if somebody thinks I'm totally off base, but this is just my impression of what I've been dealing with most of my life. So, so I feel like I'm sideways in this video, so I keep tilting my head. Anyway, that's better. So, so I was nervous about the surgery for a lot of reasons. One, I didn't have to stop my psoriasis treatment, but I was concerned about what kind of the backlash was going to be from surgery, particularly as they made the incisions. Being that this VSG surgery is laparoscopic, it's much better than having some sort of massive, you know, opening and giant, you know, cut through your body. But to have 6 incisions, my greatest fear was that I was going to be battling psoriasis attacking those areas while they were trying to heal. And some of the biological drugs that I take actually, well, the ones I used to take, actually reduced your immune system, or they compromised your immunity, because that was the way that it was trying to combat the extra way that your body was trying to create additional cells and attack these cells. So it was, your psoriasis kind of made my body hyperimmune, and then these drugs were to reduce that. The one I'm on now doesn't do that as much, so I consulted with both my rheumatologist, my dermatologist, and my surgeon. They all felt very comfortable that I could continue on it. It's a once-a-month injection, so I had 2 weeks before surgery, and then I didn't take it again until 2 weeks after, which I just did and had no issues. But I'm really happy to report that I have not had any case of where the psoriasis has shown up in any of 6 of my incisions. I have not noticed any slowing of healing, which sometimes can happen with some of these drugs because you're immunosuppressed. So actually, it's been a non-issue for me so far, knock on everything, thank you, Jesus, is from the psoriatic arthritis and psoriasis perspective. So if that's a concern of yours, if you're somebody with psoriasis, there is a link that I've recently been reading about. And one of the reasons I really made this decision to have the surgery is because there's some real medical proof that there is a tie between obesity and psoriasis. It might be because people with psoriasis tend to be more sedentary and less outgoing because they may be embarrassed or uncomfortable with the way their skin looks. Maybe that's it. And so you see more people with psoriasis being obese, although that is certainly not. I've seen plenty of very thin people with psoriasis and psoriatic arthritis, but there is some sort of tie to that, and they also call it metabolic disorder, which I don't, again, non-medical here, they kind of lump into this big bucket called metabolic disorder, but that's kind of what they were telling me. And so there is absolute proof that when you lose weight, patients do better, obviously, when it comes to arthritis conditions, because you're just taking that weight off your joints, and anything to help the joints be healthier and move better is great. So that's my little spiel about, you know, psoriatic arthritis and how VSG has impacted me or not. You know, I'm only 2 weeks post-op. So far, it's been good and it's been a non-issue. And again, I'm continuing my treatment. And I haven't had any kind of backlash, which is great. I'm extremely grateful for that. And so hopefully anyone else going through this will have a very similar experience. So, you know, to wrap up, it's been a great week. I didn't have any issues with work. I do work from home. I sit here at this desk in front of this camera that I'm speaking to you now and do a lot of WebEx conference calls and meetings, and I spent a lot of time on my computer, so that was convenient for me. I didn't have to go somewhere where I can't imagine having the surgery and going back a week if I had to do any kind of manual labor or doing a lot of walking and a lot of, you know, not being able to sit down with my, you know, trusty water bottle at my side and being able to drink all day long when I'm on meetings and doing stuff. If I had not had the luxury of this role, I think it would have been way more difficult. So please don't think that this is typical. I think most people probably need 2 weeks or more to get settled, especially if they have any, you know, any pain issues or if they have nausea, because I didn't really have a lot of that. Again, I'm very grateful and very thankful. And I don't think I'm atypical, but I think, you know, sometimes in these videos, I see people who talk a lot about more of the problems that they've had, and I have not, thankfully, had a lot of that. I will say that getting the water in is tough. I mean, it's tough because, one, I think when you drink we can't drink with straws. And when I used to drink with a straw, you know, you could drink faster. Plus, you've got to take such tiny little sips at a time. Otherwise it does hurt. I mean, if I accidentally took a big gulp once with a pill, and I stopped for a second. I thought, oh great, here it comes. And about, 10, 15 seconds later, I felt this pain because it was just too much to go through that small, opening and at the time. But anyway, so it was tough. But so I'm learning, and I'm having to force myself, where I have somebody who drank tons of water, 70 plus ounces every day with no problem pre-op. I'm having to really watch it, and I'll be honest with you, I think I told the doctor I'm getting all my water in. I'm not getting 64 ounces of water in. I'm thinking I'm probably getting 45, 50. And that's including the protein shakes that I'm taking or drinking throughout the day. I'm still, even though I've had some tuna and I've had some egg, I'm still drinking protein shakes to get the rest of that in. And so I'm counting that as some of my liquid. I'm watching very carefully for signs of dehydration. I watch the color of my urine. I'm watching, I'm noticing if I get dizzy or tired or whatever, lethargic. But I think, from everything that I've seen, it's good. And I haven't had any additional blood work done since surgery. I don't have another appointment with my doctor until July, which will be 3 months post-op. So, or 2 months, May, June, July, 3 months post-op. So anyway, so that's really all I had. I think things are going really well. I can step back and show you my scars. Actually, let me show you, because I was able to pull all the glue off. He told me I could pull that off, and I was nervous about it at first, but really it was nothing. But let me show you guys if you can see. And I don't have my glasses on, so I can't really see. I don't know where I put them. Let's see. Here we go. Give me a moment. Okay. So this was the scar, that little tiny thing there, if you can see that. That was from the hiatal hernia repair. This one was up here. I have 6 total. I can't get total. See the one there on the belly button. Another one there. Oops. And then this way, one here. So I probably didn't hit them all, but for some reason these two are the biggest bruises that I have. But this is the spot down here where they actually took my stomach out, right here, which is my biggest scar. But it's also tiny, really. I mean, it's not much at all. So anyway, sorry, this has been a bit of a messy video, but I just wanted to come in and say I'm doing well, and the weight seems to keep falling off slowly but surely. And so I'll check in next week. Thanks so much. Take care. Bye.